Hello, and welcome to another episode of the Legislative Lens, spotlighting state laws podcast. I'm the host, Tim Wilkins, and today's topic, and this episode's topic, is Senate Bill 490 out of the 88th legislature out of the great state of Texas. What that bill does, ladies and gentlemen, has to deal with the topic of hospital bills requirements from healthcare providers to patients. So, what does that all mean, Tim? Well, in the past, if anyone's ever gone to a hospital here in the great state of Texas or other healthcare providers, they'll receive a bill in the mail, and it just states, services and cost. In this particular bill, it requires the bill to have plain language so everyone can understand it, and that every line or every charge has an itemized line item attached to it. So, very, very important, because anyone that's ever gone through a healthcare system or any kind of, it would be really, really important is that, it's really annoying when you get a bill in the mail from a healthcare provider and it just says services rendered and it doesn't give you anything of what you got charged for, but it's an astronomical charge. So in order to get those charges, though, you usually would have to go through some kind of bureaucratic hoops and boundaries. And so it's important. It's pretty straightforward, but really the only drawback and resistance that this bill saw was not through the two chambers of the legislature, but from hospital groups seeking procedural tweaks. So in changes like that. So patients are already legally entitled to an itemized breakdown upon request, but you actually have to request it. So a couple things in mind here. Upon services being rendered at a hospital or a healthcare provider, you will receive a bill that for what's being charged, and also it really avoids being overcharged for services that weren't rendered. Right. So I think it's self-explanatory. Anyone that's ever gone through any type of medical care, it's pretty clear that what you want to deal with. And I don't think it's outside the norm or scope of what you're asking them to do. But you're really, it's a key thing here is that people, instead of asking them to request the itemized bill, this automatically gets that to the person. So there's no more bureaucratic and organizational downfalls here. There is a straightforward process. Okay, so let's go into that a little bit more. Many of us, or if anyone that's ever gone to the hospital before, doesn't matter if you have insurance or you don't have insurance, it is really important to see what you're being charged, right? You don't want to not see what's charged, and that's really what it comes down to. I think what it all really boils down to is that if people should be able to see what they're being charged for certain fees, how much an MRI costs, how much a procedure, how much it costs to get blood work done, how much it costs for IV fluid, how much this, how much that. It's really, I think it's laid out and it's straightforward. It's been a similar bill has been processed before in the Senate, but it didn't get over the hurdles, and that's the key part there. And I think this law became a law in September. It was finalized and signed into law over the summer, but it became effective in September 1st. So I think overall, the citizens of Texas will see a huge, huge benefit to said thing and to said law. And I think it's a straightforward and should be clear. And that's what you want. You want a clear, concise law that benefits the citizens of Texas. And it can't get any better than that, if you ask me. So thank you very much for joining me. Keep it short, keep it simple here, but that's pretty straightforward. It's Senate Bill 490 out of the 88th legislature. Feel free to continue. Everyone has a great day.